My job for you is to go through the migraine headaches as they pertain to Chinese medicine. For those of you who suffer from migraines or know people who suffer from migraines, these can be extremely debilitating. So, we're going to move into the Chinese medicine aspects of how to reframe migraine headaches and how to understand the root patterns and some of the branch patterns associated with migraines after we just again go through a brief review of the Western medicine. Again, it's important because some of you may have gone through the whole webinar and now you're coming back and just reviewing the Chinese medicine portion of it. So I like to include a little bit of a brief review so it's convenient for you. And then you have these things fresh in your mind before we dive into the Chinese medicine too. Okay. So an overview of migraines from a Western medical perspective. Again, a migraine headache, typically a headache that causes severe throbbing pain or a pulsing sensation. Again, that's a very limited description of how these can plague someone, but typically very severe and often pulsing, usually one side of the head. Again, this idea of one-sided migraine or one-sided headache describing a migraine is sort of a typical migraine presentation when we think about it or hear about it. However, it is important to bear in mind that migraine headaches can actually strike anywhere in the head. They can have complex presentations. They can begin in one area and move to another. So it's not always just one-sided. It can actually be a whole head. So it's important that you don't necessarily get too fixated on that. Some of the defining, I think, characteristics of migraine headaches are these prodromal symptoms. These are symptoms that are not the headache itself, not the pain in the head itself, but symptoms that will precede a headache called the prodrome period. And these are often nausea and vomiting. These are very typical, along with sensitivity to light and sound. These are some of the most common aspects that we would see in migraine sufferers. Not all migraine sufferers will exhibit these particular symptoms, but it's not unusual for them at the same time. Okay, and so migraine attacks, so the migraine attack can include the prodromal period. It can include the aura, if there is an aura, the headache itself, and then also the postdrome period can last, several hours to days. Sometimes, for really unfortunate souls, the migraine headache aspect of this can actually go on for several days itself, and this is something that can really devastate someone's quality of life. And again, you can see this in this last sentence, that the pain is so severe that it interferes with your daily activities. I would say that if you're a migraine sufferer and you have severe migraines, or you know someone who does, you would agree that can be it's an understatement. And in fact, it can be quite debilitating and destroy the quality of life for people who suffer from this condition. So it's something that we just want to bear in mind, that people that are coming to you for migraines are usually, we're the practitioner of last resort, as we know, and they've seen sort of the whole gamut of professionals, and sometimes they come to us as a last resort, and so they're oftentimes not doing so well. So we get an opportunity to typically see them on days when they're feeling a little bit better. Most of the time, they're not going to come in the midst of a migraine, although that does happen. Typically, when they're feeling better between migraines, we get a chance to evaluate some of the root patterns, and then we can see how the branch patterns manifest in the actual headache attacks themselves, which gives us a unique perspective in Chinese medicine. For some people, there is the symptom of an aura. An aura occurs before or even with the headache, and so that can include a wide variety of different presentations. Can be visual disturbances like flashing lights, or even blind spots, so disturbance or blind areas within the visual field. Tingling on one side of the face, or even the arms, legs, and it can also include difficulty speaking, as we saw in the clip of the news reporter in Dr. Lombardi's section. So these are all possibilities of how a migraine can present. And again, most of the time in Chinese medicine, what we're trying to do is look at the root pattern that may be responsible for any or all of these prodromal symptoms, including aura, as well as the painful portion of it, the headache, which is the thing that most people are looking for help with when they come to see us. They really want the headaches to go away. That's kind of the biggest thing. Okay. So this last little section down here, medications can help prevent migraines and make them less painful. The right medicines combined with self-help remedies and lifestyle changes might help. Again, there's There's a lot to be said about that, and I encourage you to make sure you do your additional research on these particular areas, things that you can offer your patients as far as advice, lifestyle changes, and even dietary recommendations per their patterns and scientific data. So again, when we look at symptoms, it's actually kind of interesting. There's a wide variety of ages that migraines can affect. Children and teenagers, as well as adults, again, they can progress all through the 4 stages that I spoke about. And again, not everyone who has a migraine goes through all these stages. Most of the time, I think he gave an average age of migraine sufferers to typically between somewhere 18 and 44, 18 and 45. So you can see there's a pretty wide range of ages, and typically female patients outnumber male patients pretty significantly regarding the suffering of migraines. So we'll briefly look at the prodrome. Again, these are all wide variety of different symptoms that can occur leading up to the migraine. They're sort of a warning sign, a harbinger, if you will, of migraines. Constipation, so changes in bowel habits, is one. Mood changes from depression to euphoria. That shouldn't be all that surprising given the neurological nature of migraines. Food cravings, neck stiffness, increased urination, even fluid retention, and frequent yawning. These are all signs that have been observed in the lead up to the onset of a migraine headache. And the aura, again, just briefly, typically these are visual, not always, but visual phenomena. As you can see, bright flashes of lights, bright spots, that type of thing. You can have vision loss. They can be partial obstruction of the visual field. Some people actually experience pretty significant loss of vision. And then you can get these other more systemic, or I guess extremity numbness and tingling, or pins and needles sensations. People even get weakness on one side of the face or the body. So it can mimic other more serious conditions if the person doesn't already have a pre-established diagnosis of migraines. It can certainly frighten practitioners and people alike into thinking that maybe there's a stroke or something occurring. So it's very recommended that if this is new to the patient, that they're immediately evaluated in that situation. And of course, difficulty speaking is another one. So all of these neurological effects that may accompany the early stages of a migraine. The attack itself, and again, this is sort of the focus of what we're trying to eliminate, because most of the time the patients are having difficulty ameliorating the extremely painful aspects, the head pain aspects of a migraine. And that's typically where medications maybe aren't working or aren't working as well, or they're just concerned about being on so many medications or such strong medications that they come and seek Chinese medicine to see if we can begin to help eliminate the need for the medication, or at least maybe dial back how much medication they need. So again, the attack itself, as I spoke about before, about 4 to 72 hours. So you can see there's a really wide range of possibilities in terms of duration. And how often migraines occur, again, it varies from person to person. So they can happen a lot, several times even per week. They can happen relatively rarely, maybe once or twice a month. So it's difficult to say. But again, during the migraine, the pain is usually on one side of the head, but not often, not always. It can be both sides. The pain throbs or pulses. And again, the pain descriptions of these vary a little bit too. Sensitivity to light and sound, and sometimes smell and touch. Again, not in all patients. Nausea and vomiting, again, not in all patients. And so this is one of the things that's frustrating about this. We don't really know a lot about these mechanisms of action necessarily. There's theories and ideas, but no one really has it pinned down. And that's what makes it a perfect and ripe ground for Chinese medicine to have a lot to offer as well. Briefly, the postdrome. So after the migraine, oftentimes migraineurs will feel drained or confused or just wiped out for a day or so, because they've just gone through a really painful experience that's been protracted, and just wipes you out. Being in pain like that is very debilitating. On the flip side, I guess the next line says some people feel elated. So maybe the relief from pain and the migraine being gone actually makes them feel fantastic. So go figure. The human experience is a mystery. Sudden head movement might bring on the pain again briefly. Okay, so that's just something to keep in mind. All right. So our interest in Chinese medicine, when we look at the natural history of a migraine, is to look at this progression through the prodrome, the aura phase, the headache itself, and the postdrome. And one of the reasons why we want to look at this is because it kind of shows how one or two of our patterns that we're going to really be exploring can explain so much of all of these prodromal symptoms, certainly many of these aura symptoms, and then the headache itself. We can kind of look carefully at how a few of these root patterns are actually going to address most of what a person might be suffering with during these particular periods of time. We'll get into that in just a moment, but I want you to look at this timeline of a migraine headache because it really does show you this natural history, this arc of clinical presentation. And as you familiarize yourself with this, it's going to make more sense as we look at the patterns that are involved. It'll say, oh, okay, that actually makes sense that this pattern would actually sort of precede or cause some of these problems and then give way to some of these other signs and symptoms. And so I just want you to take a look at this, and we'll visit this again in a moment. Those of you who know my style, reframing is at the heart of everything that we do in Chinese medicine. We take a Western medical disease diagnosis like a migraine headache, and we turn it into Chinese medicine. We have to find a Chinese disease that sort of describes what does a migraine headache mean in Chinese medicine. The primary symptom of a migraine headache in Chinese medicine is, of course, totong, head pain, right? Head pain is the key symptom of most migraine presentations. That's kind of what most people are going to come and see us for, is because their head hurts, right? And we know if we look this up and we kind of compile a list that there's no less than 11 common patterns which may be the cause of head pain. Okay, so when we look at head pain, wind cold, wind heat, wind damp, liver yang rising, liver fire, blood stasis, on, right? We look at this list, we compile it, and we realize, okay, so we have around 11 patterns or so that might be responsible for what we call a migraine headache in Chinese medicine. So our job clinically is to begin the reduction process. We look for the usual suspects, the things that are going to be most likely candidates for the way that these headaches present, given their chronic nature in most cases, okay? One-sided head pain is actually another further refinement of the head pain category in Chinese medicine, and you'll see that it actually has quite a few less signs and symptoms, patterns, quite a few less patterns, but we'll kind of revisit this in a moment because a combination of these two is actually going to give us the best chance at being able to narrow down what's likely affecting our patient. So people ask about acute wind strikes, right? Like acute wind headaches, wind cold, wind heat, wind damp headaches. But believe it or not, acute wind headaches, acute wind strikes are not as common a pattern in the presentation of migraine headaches. And there's a couple of reasons for that. But the big one is that most migraine headaches are usually the result of chronic and enduring disease or long-standing internally engendering patterns versus patterns that are the result of an external contraction of wind evil or wind strike. Not to say that it can't be complicated by that, but more often, as we'll see as we move through, these chronic patterns of migraine are much more often internally engendered by either the emotional states, the affect damages, or oftentimes food and drink substance, and simply the aging process. And so we don't focus so much on acute wind strike as the potential for migraine headaches for those reasons. It is possible, though, that maybe once a long time ago that there was an external contraction of a wind evil, and now we have a deep lying or an unresolved wind evil, whether it's a heat evil or a damp evil or a cold evil, that there's some retained evil that could be complicating the picture, and that is entirely possible. And again, anything that's going to be retained heat or retained cold or damp could exacerbate liver depression by further obstructing the free flow of qi. That's sort of what those evils do. They obstruct the free flow of qi in a variety of ways. And as we move forward into this, we're going to see the importance that the liver plays in every presentation of a migraine headache. And so what we'll do for this portion is we're just going to strike the wind patterns if we're talking specifically migraines, and we're going to focus a little bit more on what's left here. And you can see the combination from the left-hand category and the right-hand category that there is some overlap. But as I kind of hinted, is that all migraine diseases, all the mechanisms that are responsible for migraines that we see involve the liver in some capacity. And if you go and look carefully at most of these patterns and you look at most of these symptoms, you can see very easily, if you really understand your pathomechanisms, the way that the liver really could create almost all of this. Okay. Back to this image again. If we're carefully looking at the prodrome, irritability, right? Liver depression can easily cause irritability. Irritability can easily cause liver depression. Depression, emotional depression, certainly could be a sequelae of liver depression for any number of mechanisms, whether it's liver depression, Qi stagnation, causing spleen Qi vacuity, leading to heart blood vacuity or heart Qi vacuity, any number of things that can affect the affect or the emotion or the Shen. Yawning can be a little bit more of a complicated process, but certainly liver depression can play a role in that. Increased need to urinate. Again, polyuria is not always just kidney yang vacuity. Polyuria can actually have to do with stomach heat, and certainly liver invading the stomach is a very common cause of polyuria, particularly in younger patients. I actually made a post about this. You can look that up. Food cravings, again, could be liver spleen disharmony. On down the line, I'll leave this to you to look at each of these and try to understand and figure out through your understanding of pathomechanisms of the liver, how each one of these could actually have the liver at its root. And I think you'll be very surprised at how easy it is to make those connections. So important to remember that the liver is involved in every single mechanism to one extent or another of a migraine headache. So we're going to introduce this concept of the bell curve. And the bell curve is just an average, right? There's an average patient, an average grouping of signs and symptoms that fit kind of the majority of patients that you're likely to see in your clinic. And then, of course, on the edges, there'll be outliers, but the majority, the bulk of people that you're going to see that are suffering from migraines will have a pretty slim presentation of patterns, signs and symptoms, etc. So let's take a look at what we do with the bell curve to introduce this concept. The concept of the average Western patient, typically 25 to 55 years old, usually in a slightly higher income bracket, although that's changed some over the years now. Acupuncture's more accessible. There's more people seeking it out, so the income brackets are a little bit wider. But most of the time in Western patients, these are affluent people. These aren't people that are typically living close to the bone. They're not borderlining starving. Most of the time, these patients live in climate control. They have access to food every day for the most part. Nice, warm, comfortable beds. So these are your average Western patients, are going to be considerably different than some of the patients that are described in textbooks. And that's really important to bear in mind with how we think about our patients and the likely patterns that they'll present with. Average Western patient visiting a Chinese medicine practitioner is typically female on average, and that's the sex assigned at birth, female. Often balancing career with parenthood. Often eating on the go and or processed food. This is sort of just the byproduct of the standard Western diet and standard Western lifestyle. Sleep often poor and or sacrificed. Recreational drugs are commonplace. They're part and parcel with the modern world, and that includes coffee and alcohol as kind of the big and most common ones. And then overweight, or at least obese, or at least overweight, carrying a little bit of extra weight, plus sedentary lifestyle. We sort of know where this leads. So if we look at this average Western patient, it begins to let us assume certain patterns are going to be much more likely than other patterns. And that actually plays out in clinical reality, which is what we're trying to emphasize in these classes, the clinical reality of the Western clinic, modern Western clinic. So the average Western patient of a migraine headache, 25 to 55 and female, and the average migraineur is 18 to 44 and also a female. Sorry, I meant to say the average Western patient of a Chinese medicine practitioner is 25 to 55 and female. The average migraineur in the West is 18 to 44 and female. So they fit sort of hand in glove here with what we're likely to see in our clinics. The average Western patient, as you might imagine, based on that list of everything that I showed in terms of their lifestyle and all of it, is going to suffer from a combination of these things: Qi stagnation, heat, Qi vacuity, dampness accumulation, blood vacuity, and blood stasis. These are the top. These are the things that you'll see in various combinations in almost every single Western patient that comes through your door. I know we talk about yin vacuity, yang vacuity, and those things do exist, but by far, given the patient base that we see, Americans and Westerners in general, as compared to the ancient Chinese living in different climates with different stressors, much more exposed to elements, etc., our patients are fairly robust by example and by comparison. And so these are the combinations that we're really going to see a lot. The average migraineur, again, if we kind of average out the patterns that we're most likely to see, we just sort of take an average of those slides that we were showing before regarding head pain in Chinese medicine: liver yang rising, liver fire, qi vacuity, dampened phlegm, blood vacuity, and blood stasis. Look at these two columns for a moment and really examine those. You can see how it's very easy to see that one of these average Western patients could easily manifest all of these signs and symptoms of the average migraineur. Okay? It's important to really let that sink in for a moment and see that it's sort of a foregone conclusion in many ways. So if in the middle of the bell curve, we have about 80 to 85% of your average patients coming in with these patterns that we discussed. And then there's going to be outliers, right, that are going to have maybe the yin vacuity, yang vacuity, depending on their age, constitution, other things that might kind of fall in. But the bulk majority of patients that you see are going to have really one of these or a combination of these 6 patterns presenting, regardless of whether it's a migraine headache or a digestive issue or insomnia, whatever it is that they're coming to you for. These are going to be the patterns that they're going to be presenting, and then you have to put together, well, what does that mean in the context of their chief complaints? In this case, migraine headaches. We can explain easily how these patterns are causing what we call a migraine. So what I'm going to do in this class is make it really easy for you and really help boil it down for you with these real life clinical pattern clusters. These real life clinical pattern clusters are what you're really going to see based on the age of your patients and the type of pattern presentations that really show up together, right? So in textbooks, they show you individual patterns. It's not realistic. In real life and in the clinic, there's combinations of patterns that sort of mutually co-engender that concept in Chinese medicine, that you often find them together because they make each other if you really look carefully at it. So one of them is this concept of qi stagnation, and that's in parentheses because you don't usually see qi stagnation as a cause. But again, there's none of this that happens without the liver. So qi stagnation is always present. Qi vacuity, blood vacuity, and then some form of heat, whether it's depressive heat or it's worse, liver fire. That's one category that you're going to see in patients. The other category is you're going to see kidney yin yang vacuity, especially as patients get a little bit older, but this ascendant liver yang hyperactivity pattern, also known as liver yang rising. This is another pattern. Believe it or not, in the vast majority of cases of migraine headaches, this one is not the one that's the most responsible. Very often, it's actually this first category, given that most migraineurs are typically a little bit on the younger side. You're going to see actually more of this first one than the second one. Ascendant liver yang hyperactivity is actually overdiagnosed and it's overtreated, and oftentimes people don't get very good results when they give the formulas associated with that because they jump right to it without really doing a good pattern discrimination. So that's what we're hoping to clear up here with Chinese medicine. So these 2 main patterns, and then number 1, you find in younger, more robust patients, these sort of replete patterns like the replete heat, depressive heat, or fire. And then in older, less robust patients, you get these vacuity patterns. Ascendant liver yang hyperactivity, if you look it up from a textbook perspective, is actually born of a vacuity pattern. That's actually what allows the liver yang hyperactivity is, in fact, typically a liver blood kidney yin vacuity. And so you typically see this in older patients. Not always, but typically. And then these 2, of course, can easily be complicated by dampened phlegm and blood stasis. Okay, and that should make sense to you, that either of these, if you look at them, you could see the potential for damp phlegm and blood stasis to complicate these 2. Dampened phlegm by itself or blood stasis by itself is not something that you typically see, these single patterns causing migraine headaches. It's typically a combination of patterns complicated by blood stasis and or damp phlegm. Okay, so I want to be clear about that. We're going to really examine these 2 to show you how to narrow it down. Okay, so often younger, more robust constitution. Okay, this is chi stagnation, chi vacuity, blood vacuity combination. This is our first one. Okay, usually in patients younger than 40 to 45 years old, which is sort of the vast majority of migraineurs if you look at the data. Common in menstrual cycle migraines. So if those of you who are gynecology experts or curious about gynecology and getting into it and have questions about migraines during the menstrual cycle, this pattern is by far the most common one. This cluster of patterns is by far the most common in menstrual cycle migraines. And again, the nature of these migraines is, I shouldn't even call it a migraine yet, but it's sort of a precursor to a migraine. More chronic, dull, and background headaches that have acute exacerbations at certain times of the cycle. That's with specific regard to menstrual migraines. But if maybe it's not linked with certain times of the cycle, and that's okay, that happens. Still, it'll be a chronic, dull background headache with acute exacerbations at other times. The point here is that this type of headache begins with a sort of chronic, dull background headache, and then it has acute exacerbations. Just want to be clear about that. Okay. So here's our rough patient profile. Here's our bell curve. This is a liver spleen disharmony. Lo and behold, it rears its head. The liver spleen disharmony. Why is it a liver spleen disharmony? Well, because you have liver depression, chi stagnation, and you have spleen chi vacuity. And then, of course, spleen chi vacuity, because the spleen is the latter heaven root of the engenderment and transformation of chi and blood. The spleen makes the chi, makes the blood, can lead to blood vacuity. Okay, so this is a classic liver spleen disharmony plus blood vacuity, causing this sort of background, dull, chronic headache. Okay, very, very common cluster of patterns together, and again, very easily complicated by dampness, phlegm, blood stasis, and then, of course, heat. Naturally, anytime you have any kind of stagnation, you run the risk of heat or fire. All right, so let's look carefully at this then. Core clinical signs and symptoms. All right, here's our cluster: chi stagnation, chi vacuity, blood vacuity. What are our core clinical signs and symptoms of this type of headache? Well, we have all the usual suspects for the liver spleen or the liver chi stagnation. We're looking at those types of signs and symptoms, the usual signs and symptoms of spleen chi vacuity, and the usual signs and symptoms of blood vacuity, plus a headache, right? And a headache of a specific type. So persistent background, achy, tension type headache, right? Not throbbing and severe. Okay, I want to reiterate that. These headaches are not throbbing or severe. They're tension. They feel like sometimes squeezing, right? Like your head can be like in a vice, like there's a squeezing pressure, achy type sensation. And oftentimes patients wake up in the morning with these types of headaches. So it kind of begins their day. Okay. Generally at the occiput. Occiput's a typical place for these to begin. But they typically, not always, but more often than not, in my experience, and I actually suffer from headaches like this, surprise, surprise, chi stagnation, that it begins in the occiput and it migrates behind one or both eyes, and it can be temporal or frontal as well. So you can see a couple of these illustrations. Not unusual at all for that process throughout the day for the headache to migrate to a specific area. And again, just because it migrates to that area doesn't mean that it's not also simultaneously in the other areas too. Sometimes it can be in both, sometimes it can go to one. And again, caused or worsened by, remember this two-way streets, right? Caused or worsened by emotional stimulation and or fatigue. That kind of makes sense if you look at chi stagnation. If a person's emotionally upset, irritated in whatever capacity, right? Chi stagnation gets worse. If they have a lot of fatigue, if they have chi vacuity or blood vacuity, that's going to exacerbate those aspects of the headache, right? Either way, you kind of run into making this headache worse or basically creating the ground for the onset of this headache. All right. Again, as I stated before, it can be worse at mid-cycle or premenstrually. This makes sense regarding chi stagnation, especially because the middle of the cycle is when there's the transformation from the yin dominance to the yang dominance, and that is facilitated by the liver. The importance of the liver being able to free course and discharge and facilitate that that yang aspect, transforming that yin aspect into that yang dominant half is critical. If the liver is depressed, then you may actually get an increase in liver depression, qi stagnation signs and symptoms around this time. And as we're moving forward here, you'll see how a headache like this might appear and then actually get worse at this time. Same holds true for the menses, as that transformation from yang dominance into yin dominance, the ushering in of the menses, also under control of the liver. If there's liver depression, qi stagnation at that time, which there so commonly is in the premenstrual period, then headaches can actually begin to form then and dominate throughout that particular period in a variety of ways also. So just bear in mind that if you have a patient that's suffering menstrual migraines, this pattern is going to be highly suspect. Watch for this. Okay. And there's additional signs and symptoms. And again, these are often the prodromal signs and symptoms we talked about, but blurred vision, tunnel vision, photophobia, numbness and tingling of the extremities and face, possible constipation, loose stools, cold hands and feet, right? If you look carefully at a liver spleen disharmony with blood vacuity, you can pretty much explain every single one of these. Okay. So those are our core clinical signs and symptoms of this qi stagnation, qi vacuity, blood vacuity combo of headache in terms of its basic form. So your base formula is going to be none other than the rambling powder, the Xiaoyaosan, right? But again, when you look at a qi stagnation, qi vacuity, blood vacuity headache, your treatment principles are going to be course the liver, rectify the qi, right? Eliminate stagnation, supplement the spleen and supplement the qi, and then of course nourish blood, right? Those are the treatment principles, and Xiaoyaosan accomplishes those things beautifully. However, the other treatment principle, since there's a headache involved or head pain involved, is to eliminate pain. And so you need to do what you have to eliminate pain, right? Eliminate pain gives you the ability to choose any number of medicinals that are known to eliminate pain in the head. The ones that I think work superior are chuancheng and baizhi. Chuancheng and baizhi are actually added to almost all migraine headaches. Again, not all migraine headaches, almost all. There's some that's a little more risky to add this combo than others, but you'll see this pair show up again and again because they're so effective at alleviating head pain, sort of wherever, right? So there's something that we add to Xiaoyaosan because we're not just treating liver depression, qi stagnation, spleen qi vacuity, and blood vacuity. We're treating those manifesting as a headache. So we add these medicinals. Okay, that's your base formula. I would consider this your base formula. What happens if the liver transforms into depressive heat, right? We start getting heat signs coming up, right? So maybe we get, maybe our eyes are a little itchy and red, or maybe not itchy, but red or burning, or maybe there's flushing because they feel warm or they're irritable and frustrated, and that transforms depressive heat, right? Well, then you can add medicinals. You can add, of course, the first two are actually the last two on this list, but Mudampi and Jirza actually create what we all know as Jiawei Xiaoyaosan, but actually more accurately, Danzhi Xiaoyaosan. Jiawei Xiaoyaosan means Xiaoyaosan with additions and subtractions, so it's better to say Danzhi Xiaoyaosan to be more accurate when you get your formula. And then if you want to say truly Jiawei Xiaoyaosan, then you can say, Jiawei Xiaoyaosan, Jirza, Mudampi, and you could add Juhua and Shakusao if the heat is particularly pronounced or the eyes are being affected. These are some medicinals that you would want to use at your discretion. So think about the way that it's presenting, and then you can modify your formula for that. What happens if this pattern is also complicated by blood stasis? Because that never happens, right? Qi stagnation, qi vacuity, blood vacuity, that never leads to blood stasis, right, at the same time. So if this pattern is complicated by blood stasis, there's a few medicinals that are super effective at also helping this pain. So you take your base formula of, Xiaoyaosan plus chuancheng and baizhi, and then you can add danshen, salvia, not dangshen, danshen, salvia, taoren and honghua. So those quicken the blood, dispel stasis, and danshen has the additional aspect of also nourishing the blood, at the same time slightly cooling as well. And then if there's long-standing blood stasis, and this has to do with chronic migraineurs, people who have been suffering these types of headaches for, a year, 2 years, 5 years, 10 years, long-standing, right? There's a saying in Chinese medicine that new diseases are in the vessels and old or chronic diseases are in the network vessels. And these are the tiny little vessels. Okay. And the way to get into those vessels is to use what Flaws always calls the bugs. You got to get in there with scorpion or centipede or earthworm, right? Chuanshe, wugong, and dilong, something like that. There's any number that you could choose. But again, remember, these are toxic medicinals. So make sure that you understand, what you're doing with these. They're very small dosages. You don't need a lot, but you can add these into these formulas to make them all the more effective. And some people might argue that, in fact, you actually have to include these in chronic migraine headaches that involve blood stasis in the network vessels like this. So again, if it's a long-standing migraine pattern that is complicated by blood stasis, which they almost always are, then you may want to consider adding some of these medicinals. Again, qi vacuity or blood vacuity, if it's more pronounced, then you can feel free to add huang qi, dang shen, ji shui tang, hu shu wu. Again, not during the headache. This would be more appropriate sort of in between, right? So what we're showing in the first few combinations of formulas here is what you would do during the acute attack of the migraine, just before, as the patient feels it coming on, or during the migraine, if they can take the medicinals. That's more appropriate for, the first three categories. Again, once the migraine subsides and we're working on the root pattern phase of this qi stagnation, qi vacuity, blood vacuity, maybe there's some more pronounced qi and blood vacuity. You can actually add some of those medicinals during that time. But again, we're staging treatments. You want to make sure that during the attack of the migraine, you go with the formulas that are appropriate for alleviating the head pain and addressing the pattern that's at hand. And then in between, you may have to change formulas completely or modify the formula to be more appropriate for treating the root patterns to hopefully eliminate either the headache altogether in a perfect world, or certainly the frequency of the headache, and maybe even the duration, as well as the extremity of the headache, or the extreme nature of the headache, I should say. Okay. And again, you have this forever. So go back and watch this. If that went too quickly, go back and watch it again and try to make sense of what's being said here. Okay. Okay. Now, again, that's a liver spleen disharmony with blood vacuity and maybe depressive heat and blood stasis combination. That's what we saw. What happens if in a younger, more robust patient, their constitution, they actually transform liver fire? Okay, not liver heat, depressive heat, something like that. That's like, it's a lesser degree. Liver fire is a pretty severe presentation. It tends to flare up fairly quickly. It's not something that sticks around for a long time, but when it presents, it can be hellacious in presentation. So younger, more robust people, always liver fire. This is a replete condition born of a robust constitution, okay? Commonly due to alcohol, coffee, and stimulants. But again, alcohol is a big one here. This is the classic pounding, throbbing, splitting alcohol-induced headache that you might incur after a night of drinking, or sometimes even during drinking it happens, right? So generally, it's an acute exacerbation of an existing background headache. And this goes back to the pattern we saw before, which is a dull headache, sort of achy. If a person drinks a bunch of alcohol that's young and robust, or drinks too much coffee, or takes drugs or stimulants, it can flare the fire, the liver fire. It's actually a flaring of the ministerial fire, which is intimately connected with the liver, right? Upward flaring of this fire because they're young, okay? So you have the usual liver signs and symptoms, but now you have these severe, intense, pounding, splitting pain, particularly in the temples, right? Temples is kind of the main thing here. And you can see that these are red to sort of exemplify like the location, and then also just the severity of where you're likely to see this. The patient may actually be extremely angry, irascible, very upset. That may actually cause the migraine to begin, or as a result of being in so much pain, they may be extremely irritated because it hurts so much. They might be very short and angry with people around them because they're in a lot of pain, okay? Either way, liver fire, okay, classic signs and symptoms. The eyes may turn red and burn. You might get a flushing. You may actually see their face turning red. That's sort of what this illustration is trying to show, okay? And then there's a couple other things. If this is really extreme, possible loss of hearing and swelling of the ears, like visibly swelling of the ears. You can actually get epistaxis, where a person might actually get a nosebleed, because if you remember in Chinese medicine, the 3 causes of pathological bleeding, of which nosebleed is one, okay, is due to either qi vacuity, blood stasis or heat, right? And in this case, extreme heat, fire actually pushing blood outside the vessels, okay, causing a nosebleed. And again, possible dizziness if this is actually transformed into internal wind or engendered internal wind. And internal wind really is nothing more than a very strong upward surge of qi yang. That's really what internal wind is. Okay, so this is a very extreme thing, and you do actually see this a lot in these types of headaches. It's not always due to alcohol, but it can be. In a younger person, also, it can also come about as the result of what we call a weekend headache, where people actually decompress on the weekends. All week long, young people are being overworked. They're at jobs where they're underpaid, overworked, kind of paying their dues, like gutting it out, really stressed, really focused, drinking lots of coffee, drinking alcohol. And then on the weekend, they relax if they can. They go home, they relax, they're watching TV, and all of a sudden, whoa, they get this really bad migraine. Well, that has to do with the liver finally beginning to course again, beginning to go like move smoothly through their body and starting to course that chi that's been stagnant. And you actually get a temporary rush up of liver yang or liver fire, right? As a result of the chi starting to move again. It's this deeply constrained chi that then moves up. And so weekend type headaches in younger people especially are these types. Okay, so bear that in mind clinically also. All right. So liver fire, what do we do? Well, a patient has liver fire headache, they're going to feel terrible, and it's going to be tough to get herbs down. It's going to be really tough to get herbs down like Longdan Shegantang. But you can do it. It can be done. Longdan Shegantang is a great root formula for this because typically you're going to have some degree of liver depression, fire, and you might have some dampness because maybe they drank a bunch of alcohol and ate a bunch of greasy, crappy food and it kind of set them off. Or maybe they're home on the couch and they're mowing on wings and pizza and watching the game, and lo and behold, hung over a little bit, bam, this headache, kicks in from one of those dull background chi stagnation headaches to this splitting migraine. Again, these medicinals that you're seeing listed here are for pain. Again, for pain as appropriate. So we're clearing the liver fire, draining the liver fire, and adding medicinals that are appropriate for pain due to this pattern in the head. Okay, so a couple that you may want to consider here. Okay. Another alternative is Idan Juyin. You should look that one up. That's also, again, if there's more dampness accumulating and dampness associated with the liver fire, this formula can be extremely effective in this particular case also. So something to consider. Again, this is a tip treatment for sure. You want to try to eliminate the headache as best as possible in this particular situation, and then begin to address those root causes if possible. Okay, so let's look at middle-aged plus and less robust constitution. As we age, we all know that the aging process is really sort of the reaching of the pinnacle of strength in the spleen-stomach axis, the yang ming, and then over time, due to constant assault by bad diet, stress, poor sleep, and liver depression, the yang ming axis begins to weaken, right? And so the engenderment of qi in blood becomes less efficient, and the spleen stomach axis begins to draw more on the kidneys, more on kidney yin, more on kidney yang, and we wind up eventually with kidney yin, kidney yang vacuity, oftentimes dual kidney yin yang vacuity. As we approach middle age and older, that's not all that uncommon, particularly in women, due to the extra stresses of the menstrual cycle, and if they choose childbirth, etc., that does put an increasing tax on qi and blood, and so therefore the spleen stomach axis. And so again, since most migraineurs are typically female, this makes sense that these kidney and yang vacuity type patterns might show up more as someone's less robust in constitution. And the ascendant liver yang hyperactivity presentation of these headaches is the most common here. So again, greater than 40 to 45 years old, you want to start looking at this if a patient's having these migraine headaches. Can accompany hot flashes for obvious reasons. Again, if there's a kidney yin or yang vacuity, it's not uncommon at all. And these headaches, like liver fire, are also severe and splitting. They just are typically found in older patients. And that's one of the ways that you can distinguish that, plus the presence of kidney yin and or yang vacuity symptoms. So like we always have to do, we have to remember that kidney yin and kidney yang vacuity is an evolution. It doesn't exist in a vacuum in a patient. It actually evolves and thus includes all of the fun things that come before that. This is why the aging process is so fun, right? We get all of the things that happened when we were young now getting a little bit worse. We're going to add to it. We're going to add to chi stagnation, chi vacuity, blood vacuity, and all the other fun sequelae. We're going to add to that now kidney yin and yang, which means these all actually can exist at the same time, making this such a fun thing to work with, right? Okay, so let's step away from that for a minute and let's look at how this works, right? So we have our liver and our spleen existing harmoniously in the middle jiao, and that's key, right? This is when everything works beautifully. Liver yin, liver blood, kidney yin, spleen qi, kidney yang, and this beautiful relationship between the kidneys. Everything's working great. Everyone's happy. Awesome. Except life. Except life. Anger, frustration, irritability, chronic pain, lack of exercise, unfulfilled desires. Who gets to do whatever they want to do, whenever they want to do it all the time? Add to that potential for trauma and abuse really affects the liver. And it affects the liver sometimes from a very young age, okay? So very, very early in life, we set the stage for liver chi stagnation and all the things that come from that, right? So the spleen, if you add to that, add to the woes of the liver being imbalanced. Now we've got overthinking and analysis, anxiety and worry affecting the spleen, faulty diet, not sleeping, overworking. Oh, look at the stage that's set here between the two of these, right? Now we start to see where all the fun happens, right? So the liver invades the spleen produces chi vacuity, dampness and phlegm, blood vacuity. All of those things affect the liver. The liver, by virtue of the anger, frustration, the affect damage and disorders, chi stagnation, heat and fire, blood vacuity, blood stasis, all of these patterns become engendered by these relationships going awry in the middle jiao. That's why Li Dong Yuan in the middle jiao. It's so important to study the middle jiao, because when this is off, this happens. All of a sudden, there's chi vacuity and blood vacuity in the heart. There could be lung chi vacuity, lung yin vacuity, because these organs depend on the middle jiao functioning to create chi and blood, right? And if that happens long enough, which is where we are right now in this process of this class, it grabs hold of the kidneys, creating kidney yang vacuity, kidney yin vacuity, plus all the other fun stuff that's happening throughout the rest of this diagram. So here's our big picture, right? This is where we are. This is where we've arrived, okay? So any one of these patterns or all of them together could actually be present in any given patient. And that's what makes Chinese medicine so interesting, fun, and seemingly complicated if you don't know how one thing turns into another thing, turns into another thing. But since taking this class, we know a little clearer, right? Okay, so all right, so chi stagnation, chi vacuity, and blood vacuity from the middle jiao going haywire can eventually give way to kidney yin and yang vacuity, giving way to ascendant liver yang hyperactivity and manifesting as a headache. Okay, so let's look at the core clinical signs and symptoms of what a kidney yin yang vacuity / ascendant liver yang hyperactivity headache looks like. So you can see the locations. And we'll go into that in just a moment, but dizziness is a very common sign and symptom. So you can get the engenderment of internal wind, severe splitting and pounding, distending or pressure. Again, unilateral or bilateral, so it can be on both sides or just one side, but mostly behind the eyes and the orbital ridge and temples. So it kind of follows this pattern very commonly here, okay? Does that mean that you couldn't also have a liver chi stagnation headache starting in the back and also wrapping around to the eye? Of course you can. In real life, these things can be combined very easily, but we're just going to take a look at this, and you have to use your common sense and what you understand about pathomechanisms to see how these combine. The pain is often worse lying down and better sitting up. So here's a nice little clinical tidbit. If the patient says, when I lie down, it actually is worse, and if I sit up, maybe in bed or in a chair, it gets a little bit better. That's just something that we bear in mind, that this is actually maybe in an older patient pointing toward that pattern. And the pain tends to be worse at night, or it begins during sleep. Okay, that's common during the yin period. If there's a yin vacuity or liver depression, chi stagnation due to blood vacuity, then makes sense that this might be a sequelae to that. Okay, so your base formula here, this is the classic Tian Ma Go Tang Yin. This is the classic formula that was designed for this type of headache in a little bit older of a patient. And actually, if you look in Bensky and you study this this formula, it's kind of interesting. It was actually designed in a very Western medical way. The herbs were actually chosen in a very Western way. They chose like individual medicinals to fit into the way that they think Western hormones or chemicals or whatever would actually create the headache that they were seeing. And this formula was actually created to address hypertensive headaches. It was actually designed for headaches due to high blood pressure. One of the things that you see in Chinese medicine, and one of the weaknesses, is that high blood pressure, typically if a person's blood pressure has been very high for a very long time, that later stage you might actually start to get headaches from it or dizziness from it. That's typically not the case in the West, where we have screening processes and we can get ahead of it and treat it long before we get headaches from hypertension. And so Tianma Gotang Yin was answering a need for treating headaches that were the result of hypertension being further along than maybe we would like. But it does still fit patterns, so you can make it work. It does still fit these types of patterns. So as long as the patient's presenting that way, this formula will most likely be effective, maybe with some additions and subtractions. Again, if there's blood stasis complicating this formula, then the addition of Danshen, Taoren, Honghua, like I said before, and then maybe some of these bugs might actually make a big difference, go a long way to actually clearing this up longer term for the patient. And then again, if there's more pronounced liver, kidney, yin, vacuity, heat, then you might want to add Shudi or Shengdi, Gochizi, Zhimu, Juhua, depending on where the heat's accumulating and just how pronounced that yin vacuity is. If this is a middle-aged female patient who's having hot flashes, then you can begin to modify this a little bit, maybe between treatments, right? Between attacks, you can begin to nourish the kidney yin and make sure that you're quickening the blood and dispelling stasis, and then save the Tianma Gotang Yin for acute attacks if you like. And this is actually one of the formulas where we don't typically use the Baizhi and Chuanchong combo, because those actually aren't so great with these types of patterns, especially kidney yin vacuity patterns. It's a little bit too scattering, and so we don't typically go that way. Okay. All right, so we're going to put these in a category, the damp phlegm and blood stasis. We're going to examine them individually, but it's with the caveat and understanding that these don't present by themselves in real life. They complicate the patterns that we've just seen. They're added to them. And so you have to figure out, when it's appropriate to add medicinals for these types of things, and which ones and how much. As an herbalist, you can figure that out. With regard to blood stasis, there are cases where it can present by itself in the case of acute injuries, acute cranial head injuries, things of that nature. Then blood stasis could actually appear on its own, in which case the classic formula Tong Chao Ho Shui Tong might actually be appropriate in its entirety, plus some additions, or subtractions. But in general, these are complicating factors. Okay, so they can occur really at any age, and again, mostly in chronic and enduring diseases, especially blood stasis, and really I would add damp and phlegm to that. Okay, so mostly complicating other patterns, but let's examine them. So a damp phlegm presentation of a headache specifically, I'm kind of trying to do my best here to illustrate this, but it feels like a tight band kind of around your head, like some people say, like almost like a wet sack, or a band that's tight and it's squeezing. It feels like a squeezing kind of. People are usually cognitively just like a little fuzzy, you can't think straight, maybe some brain fog. That's that type of damp phlegm kind of clouding the orifices, if you will, and kind of creating that squeezing, heavy sensation. Okay. Some say it's like a vice, but I think that has to do less with the pain of the head, because it's not always, I think, so acute. It's more that squeezing pain. And it can concentrate in the forehead, or it can be in the whole head. Okay. And there may be numbness and insensitivity of the scalp. So if the patient throws out that little tidbit, like, yeah, my scalp just feels weird or numb or tingly or whatever, that could be indication that dampness and phlegm is involved in this particular presentation. So what do you do? The classic formula, Ban Cha, Bai Ju, Tian Ma Tang. Again, you can add Chuan Chong and Bai Ju again, and you can also add Bai Fuzi. It's really great for the headaches due to the dampness and phlegm aspect of things. again, in its purest form. What you might want to do if this is complicating another pattern is just select a few of the medicinals from that formula that you think are most appropriate for transforming the damp and phlegm, and then including the Baijiu and the Chuanchang as well. And that might be enough, just adding a few. Okay, now we're going to look at blood stasis. Okay, blood stasis, again, clinical signs and symptoms. The core of it is, the illustration kind of says it all. And I suffer from these types of headaches myself. And so I can attest that it's like having a spike. It's like having a spike, ding, stuck in your head. It's like an ice pick. It's very focal, and it's often the very same spot or location, typically behind the eye or in the temple, very specific locations. And it's a recurrent thing. It can come and go. It's not always there. Sometimes it's there, sometimes it's not. But when it's there, it's really, really focused. Okay. Piercing, sharp, stabbing, drilling, boring. All of these descriptions, I think, really do it justice. It's an exquisite pain. It's exquisitely painful. And I'm not saying that from the perspective of liking it. I'm saying it's exquisite in the sense that it's almost unbelievable how much these things can hurt. Okay. It may get worse in the evening and night, and that's typical of blood stasis patterns. That's not unusual, blood stasis patterns to get worse at night. So you would suspect, and this is kind of a cool clinical tip too, suspect blood stasis and headaches which don't heal very well over time, or they don't respond to seemingly appropriate treatment, right? So if you've been treating the patient, you've got the pattern right, you've got the medicinals right, and they just can't seem to get any headway, consider treating it as if it's blood stasis. And this kind of runs against most of what I say, but hey, you got to have exceptions, to have rules, right? And so here's one. If the patient's not responding, consider maybe that there's blood stasis in the network vessels, and maybe you're just missing some of the signs and symptoms, and then maybe treat more aggressively with a blood quickening stasis dispelling formula like Tong Chao Ho Shui Tong, plus maybe some of the bugs. Put those in there and see how that goes. Just another clinical tidbit on this. Again, this is during the attacks. In between the attacks, you want to be addressing what's causing the blood stasis, what's causing the phlegm, right? You want to make sure that you're dealing with those. But when a patient's in pain, you may have to step up the medicinals and be a little more aggressive to alleviate the pain. Okay. So Tong Chao Ho Shui Tong, again, Chuan Chong, Yan Hu Suo, great pain-killing medicinal. Yujin and Shishang Pu. Again, these open the clear orifices, and that's kind of an important thing because sometimes things get stuck in very specific areas, particularly behind the eye. Those medicinals are great additions to go in and really try to kind of blow things open and get the qi and blood moving in that area and eliminate the pain. And so that's an option for blood stasis. Again, blood stasis and damp, often complicating the whole picture. So let's take a look at a case study here, and this will be how we wrap up the class. And I want to tell you with this case study that this is actually a patient who did fantastic on this. So I don't go through all of the case. I don't have the time in this short class to go through everything, but suffice it to say, I chose this case because this patient actually did extremely well, and I can just kind of showing you how to make the diagnosis and then select the medicinals. You can change them from there, but the most important thing is your diagnosis, herbal selection, match, and then you can begin the process. All right. So our intake form, again, you've seen this before if you've taken classes from me or you're a member of TCM Hub, either the Facebook group or our local subscription community. This is the intake form that Chris and I created that eliminates the complication and confusion and shows us how to evaluate the common, typical Western patient. Okay. We have our chief complaints. We have our 4 firsts at the top. And then we go through and evaluate the liver, the spleen, the dampness and or heat. We've got a spot for tongue photos. We evaluate blood vacuity, and then simple signs and symptoms that tell us about the state of kidney yin, kidney yang. And then, of course, if the patient is female, we've got a brief area for menstruation, which the practitioner needs to follow up with in more detail if there are, in fact, menstrual disorders. Okay, but this is the basic 1-sheet form that we use. And I'll show you how it works right now. We're going to move this form over to the left, shift it over here, and we're going to put in some information about this patient. So you'll see at the top. Okay, so you can see that the patient is 25 years old, female. Her body type, height, weight, 5'5", 130 pounds, and she has red cheeks. Those are our basic descriptors. And those automatically should be telling you something. They automatically do give you a sense of her body type, her age, her biological sex, and what her cheeks are looking like do give you valuable information. Her chief complaint is migraines, and I like to keep it simple. That's what we're going after. That's the reason that the person finally picked up the phone and came to see me, is because of their migraine headache. So migraines, right? So now we begin to evaluate. Liver signs and symptoms. 1, 2, 3, 4 liver signs and symptoms. Okay. We go through this list. This is what she has. What about down here? These are our spleen signs and symptoms. She's got a couple spleen signs and symptoms. She's 25, more likely to have liver signs, some spleen signs. We begin to evaluate her bowels. They're formed and every 2 to 3 days. So she has a little bit of constipation, what we would consider constipation in Chinese medicine. She's not moving her bowel daily once, which is typical for Chinese medicine. Every 2 to 3 days suggests that there's some degree of constipation. Okay. We down here under thirst and urination, she craves large amounts of liquid, large gulps, and this is typically indicative of heat. A heat pattern will cause someone to crave large amounts of liquids with large gulps. Okay, so that's why we try to keep it simple. Okay, if you look up in the upper right here, we've got poor night vision, blurry vision, dizziness. These are blood vacuity signs. She's got a couple signs of blood vacuity. She doesn't have any signs and symptoms of kidney yin or yang vacuity, and I wouldn't expect that at 25 typically, not really. And then menstruation. She has some menstrual signs and symptoms, right? She's sharp, painful menses, excessive volume. She has mid-cycle spotting. Remember what I said about mid-cycle and migraine headaches. And then she also has a slightly, it's pretty normal actually. She's within the normal range in terms of its her menses duration every month, okay? So she has some pain in menses, some excessive volume, and some mid-cycle spotting. Those are some things that we want to look at. Okay, so why don't we ask her specifically about her migraines, and that'll actually give us maybe a little bit more information, right? Okay, so she reports having regular tension type headaches several days per week, which she often wakes with. Okay, they're dull, background, and occipital in location. Migraine headaches 3 to 4 times a month, lasting 1 to 2 days, generally at mid-cycle, and again, just before the menses. As a gynecologist, I have to tell you, this is a pattern that shows up over and over and over again. So this is real, and this is something that you're going to see a lot, sometimes at the end of a stressful week. So it's sort of like all the cliches, right? Just in the beginning of having this conversation, I knew what was going on, and I knew really what we were going to do to treat this. But she reports they start at the occiput and can quickly move around her eye to one side and settle behind her eye, orbital ridge, frontal, where they become excruciating. Now, again, I'm cleaning up this language here a little bit just to kind of be an example to you about, showing you kind of where this is going. She might not have used these words, but I put these in the words so that you understand this. The pain is fixed and stabbing, and she's sensitive to light and sound. She also reports feeling flushed, and she often will apply a cool washcloth and even remove some of her clothing to try to cool off. She's been having this pattern more or less since the onset of menstruation. So I think that was like right around 15, so 10 years or so. And in addition to other menstrual signs and symptoms, she does report dark quarter-sized clots with her menses. She denies any food triggers, but then adds quickly that red wine pretty much guarantees an attack. So this is one of these beautiful cut and dry cases, but actually in younger patients, it's kind of how it is, right? So I'm going to place what we just saw down in this lower right-hand corner here. And so we can free up the upper portion to show you my little drawing of where her head pain was and the nature of it. So we've got a little spike showing that it's blood stasis-y, and we've got some signs showing that there's, that there's some heat and the location and how it migrates. Okay, and so here we have it. And then let's take a look now at the tongue. The tongue should be revealing to us, right? So as you can see, this is a very red tongue. This is a very hot person. She's got a lot of heat built up in there. And underneath, if you can see this, I'm not sure if it's coming through in the video very clearly, but she does have blood stasis, some distended sublingual veins in the tongue that are further corroborating the signs and symptoms of blood stasis in her migraines. And so putting this all together, what we can do is now move to the diagnostic process, which we're going to take a look based on the most common signs and symptoms in a person her age and a person that's going to have a migraine in her age. Let's evaluate these things. So I put it down there, chi stagnation. If you look to the left, under liver, she's got 5. If we go below that, she's got 2 signs and symptoms of chi vacuity. She's got a couple signs and symptoms of blood vacuity. The dampness and phlegm, one, give or take. Her tongue underneath there is a little bit of can show a little bit of kind of white. It looks like, and it's also a little puffy and kind of fat in the center. That can be interpreted as a sign of phlegm, but that's not the overarching picture in this particular patient. So we're not going to focus too much on that. But blood stasis, she actually has quite a few signs and symptoms of blood stasis. And I say around 6 because some of those could be blood stasis. Some of those could be due to heat, particularly the excessive volume of menstruation. That's one that could be blood stasis coupled with and or heat. But she has quite a few signs and symptoms of blood stasis, just in terms of if you count kind of the location and the nature, boring nature of the pain in her headache, amongst that, clots, sharp cramping, painful menstruation, etc. And as you read that paragraph, you'll realize there's even more that that blood stasis is playing a pretty significant role in this particular patient as it manifests acutely, right? And then heat and fire, again, around 5 or 6. If you go through and add them up and look at it, she's got a pretty considerable amount of heat and fire. So the overarching pattern here is one of liver depression, chi stagnation in this young woman, right? And then blood stasis and heat, fire in the acute exacerbation phase, goes from being a dull background headache to, these really almost like a liver fire presentation, particularly if she drinks red wine, so there you go. Okay, so we stage the treatment. We're going to treat the root pattern in between attacks, and we're going to use ready-made modified formulas during the attacks. So between attacks, Danjur Shayasan, Jajian, so with some additions and subtractions, right, or the best choice, depending, right? So starting with that formula that courses the liver, rectifies the chi, nourishes the blood, right? Supplements the spleen, clears depressive heat because she's young. There's going to be some degree of depressive heat that then is exacerbated into liver fire or depressive heat. Okay, so between attacks, that's actually a perfectly acceptable formula, and this patient actually felt a lot better right off the bat that way. And then before, during the onset here of the attack, we can take the Danjur Shayasan and we can add Chuan Chong, Baijur, Shakusao, Juhua. We can actually modify it further to have more heat clearing effects, maybe go for the eyes a little bit more, maybe take care of the pain a little more, depending on how severe it is. Maybe if she hadn't drank alcohol or had bad diet plus alcohol, maybe we could get away with this to treat the migraine as it's presenting. If not, if she did drink alcohol and we know that that's what the root of it and it's severely painful, then the Idan Juyin or the Longdan Shegantang might be a more appropriate choice during the migraine attack itself, right? Because we have to step up our medicinals. Again, plus any medicinals that can help with pain in addition, to these base formulas, okay? So that is basically going through a case study of a younger person kind of in the prime of the age for migraine headaches, relatively. It seems simple in presentation, but actually she's got, any 5-6 patterns going on here simultaneously, which is pretty typical. And we've addressed the way that the migraine is presenting and a few variations on what we might try to make this better for her. The fact that it's involved with her menstrual cycle adds an additional layer of complication. But again, we handle this beautifully by using medicinals that course the liver and rectify the chi, both before and during the migraine attack. So that's helpful. And this patient did extremely well after about a month or 2 of treatment. She was smooth sailing, and then just a low dose of Shayasan plus the invariable, changes in life that have to occur, getting done with school or getting done with that demanding position in the job and all that stuff, which is sort of an arrival fallacy, never seems to happen. People have to come up with ways to deal with liver depression that's not medicine, right? They're a different kind of medicine. Meditation being my personal favorite. I think that really does, if everyone had a meditation practice, we would be out of business in a lot of ways. I believe that very strongly. Okay, so, all right. So that's it as far as things go for my end of things. I hope this gives you a sense of how to think about migraines. I hope you took away a lot from this. Again, you have it for a lifetime, and best of luck to you, and thank you.